Um, Welcome everybody. My name is Marty Mascaria. I am a contractor with the North Central Texas Area Agency on Aging and the North Central Texas Aging and Disability Resource Center, or ADRC, both of which are under the umbrella of the North Central Texas Council of Governments in the greater Dallas-Fort Worth, Texas area. We are blessed to have my cohorts here at the Area Agency on Aging, Melinda Gardner and Felicia Warner, and Veronica's here with the Better Business Bureau Education Foundation. But before we get started, I'm going to talk about CEUs, if I could. If we could advance one. There we go. Yeah, for those of you that are joining us today that are looking to get CEUs, we are providing complimentary CEUs for licensed social workers and licensed professional counselors that are licensed in the state of Texas. For those of you that have other licenses in Texas or licenses in some other state, you're more than welcome to go through the process and get a certificate. But please know these are the two jurisdictions we are set up for. But I've had people tell me others have taken them, and I've even had some of the other ones contact me for course information when someone's submitted a certificate to them, and that was not a problem. But please know these are the only two we're actually set up to and could defend you on. We're also offering certificates of attendance. Those are available to anybody. The rules for getting either certificate are the same. Today's webinar is worth 1.5 hours of CEU credits. You must complete the entire live webinar, and you must also complete the Google evaluation survey, which should pop up as you close out of Zoom today. If not, you'll receive that in a follow-up email. There'll be the link to that. You'll have a week to complete that, and then give us about 3 or 4 weeks to get the certificates to you once they're done. But please note that in order for us to have the documentation for your attendance, you've got to be logged in as yourself. So please note that when you sign up for these, if you're using a link that someone has shared with you, it won't show you as signed up as yourself, which negates the ability for us to provide you CEUs, because then we don't have documentation that you have attended. So please make sure in the future you sign up as yourself and then fill out the Google survey to match, and that'll do you. So I'm going to turn it over to Melinda and let Melinda introduce our speakers. Melinda?
All right. Well, thank you very much, Marty, for coordinating this for us. And thank you all for joining us today. We do have some wonderful speakers here. Felicia Warner from the Area Agency on Aging of North Central Texas. And we do cover 14 counties in the Dallas-Fort Worth area. And so she will be providing information on Medicare open enrollment. And we also have Veronica Alegria here from the Better Business Bureau Education Foundation out of Houston, who will be talking to us about open enrollment scams. So I'm looking forward to hearing both of them, and we will get started with Felicia.
Welcome, everyone. Thank you so much for taking time out from your busy week for a midweek Medicare. Hey, everyone, it's Friday Eve, so let's get started. I'm Felicia Warner. I'm a benefits counselor for North Central Texas Council of Governments, Area Agency on Aging. And our offices, how your state health insurance assistance programs can help you. We are local, as Melinda has mentioned. We serve 14 counties. We provide unbiased information, and we're confidential and knowledgeable, and we can do this on the phone or in person or virtual. This is a national insurance company, and we talk about the costs and the options of receiving your Medicare insurance to the supplement, the Medigap, or your Medicare out-of-pocket costs, and it can vary by state and territory or your local areas. And keep in mind, your individual health needs and income may also be a factor in making your Medicare decisions. And we're going to talk about that more. So this is just a little highlight of the information. And there are 54 ships in every state, including Puerto Rico, Guam, DC, and as you see, the Virgin Islands, which I really want to go to. There are over 2,000 local programs, over 12,000 counselors, 4 million individuals have been educated, and we have had over 2 million counseling sessions. And Medicare open enrollment, we call it OEP, but I'm just going to refer to it as open enrollment. And there's options for your prescription drug coverage, and we'll talk about the Medicare.gov website. And just a few fun questions. You can enroll in Medicare whenever you want, true or false. We're just kind of testing and kind of making this fun, because a lot of people think you can enroll in Medicare whenever you want. So you can put your answers in the chat and we'll just go through these real briefly.
Fifteen more seconds.
Okay.
All right.
Okay. There are rules for each type of enrollment period. A Medicare annual enrollment period begins October the 15th. And that question is false. So we'll go to the next one. Just a little small sampling. Medicare costs the same for everyone. True or false?
We have some knowledgeable people online.
That's right. That's right.
5 more seconds.
Okay. Thank you, Melinda. And that is false. Medicare does not cost the same for everyone. The exact amount depends on the specific coverage you have. And we'll go into more of that information later on in the presentation.
I hit the button too quick, so that's the next one.
Sorry. Medicare covers everything, and we can see that that is false. I wish it did, but it does not. Medicare Parts A and B do cover most prescription drugs. I'm sorry, A and B do not cover most prescription drugs, routine dental, vision, or hearing. And we'll go to the next slide. I'm sorry, Medicare Open Enrollment 2023. Here we are. But we'll just go through this, and if you have questions, please put those in the chat. Help during open enrollment. Is this a little video? I'm sorry, we have a couple embedded in this presentation, but the SHIP, it serves as a central source of information and expertise and technical assistance for our grantees. And we disseminate knowledge and best practices through the development of new products and tools. And we can help individuals during open enrollment.
Change over time, so it's
Oh,
important
there's
to
the
review
video.
your plan every year during open enrollment. When you contact your SHIP, a counselor will give you one-on-one confidential guidance based on your unique needs. SHIP can help you understand costs and coverage, compare options, find providers, correct billing issues, and more. Our counselors are members of your community, and many are volunteers. They are screened, trained, and certified as Medicare experts. SHIP isn't reimbursed by health insurance plans or paid per enrollment. So our only priority is helping you make informed decisions about your care and benefits. Navigating Medicare can be complicated. SHIP can help. Find your local SHIP office at shiphelp.org or call 877-839-2675. Things change over time.
I apologize, Felicia. It wasn't
Yes,
anything, but
Things change over
there
time.
we go. Here we go. Bear with us, everyone.
you will go on to the next slide.
Okay. All right. Again, apologize for that little glitch. But if you receive the slides, you can go through that. What is Medicare open enrollment? You can make certain changes to your health insurance coverage, including adding, dropping, or changing your Medicare Advantage and Part D coverage, even if you are happy with your current coverage. During this open enrollment, it's a good time to review and compare it with other options that you might have and make sure your current plan still meets your needs in the upcoming year. Think of it as getting service on your car. So you're taking your car to be serviced. You want to make sure it's going to keep running properly on our busy highways and roads. And for for me, it's just like trying on new shoes. You want to make sure those shoes don't hurt your feet because your Medicare is going to take care of you throughout the upcoming year. So you want to make sure it's the right plan for you. You can make again certain changes for your Medicare uh, during the open enrollment period. And just to make those changes, you can join a new Medicare Advantage plan, you can join a new prescription drug plan, or you can switch from original Medicare to Medicare Advantage, or switch back from Medicare Advantage to an original plan with or without a Part D. And each plan can vary in costs. And, when you're looking at your prescription drug coverage, you want to make sure your specific drugs are covered. We'll go to the next one. Open enrollment. Again, you will decide during this period whether you're happy with your uh, plan that you have now, but take time really to consider the costs, the coverage, and the provider choice. Find the best plan for you. And to get that information, you can call us or you can go to Medicare.gov or you can go to the Medicare, 1-800 Medicare. They are open 24 hours, 7 days a week, and I believe they only get Thanksgiving off. And so that way you can make a informed plan about your Medicare. Again, you can switch Medicare Advantage plan, change to original or back to it or leave. And your hospital insurance and your Part B medical insurance and open enrollment again is October the 15th through December the 7th. Medicare, Medicare drug coverage Part D. Uh, your drug plan, the drug plan that you take and that you consider getting, make sure all of your medications are available in the pharmacies. And really the thing to look out for is, are there any restrictions on your drug? Do you need prior authorizations? Do you need to do step therapy or are there quantity limits? Look at the monthly premiums and annual deductibles. How much will you pay at the pharmacy? Is the pharmacy in the plan your preferred network pharmacy? Can you use the mail order? The star ratings, you have retiree coverage. The Medicare prescription drug plans will work if you put in some of the time to make sure, because I have been in line at the pharmacy and people have left their medications because they didn't it just was out of their price range and they weren't aware of that. And sometimes the doctors they'll also just prescribe you something and not talk about costs with you. And we'll go to the next slide. Medicare drug coverage. Again, I'll go over this, that the medications that you take, make sure they are in your plan, and if you need to do any of these step therapies or quantity limits, that you should find out that information. And the drug plans are approved by Medicare. They're run by private companies, as you can see on the slide, and they're available for anyone with Medicare. Medicare drug coverage eligibility, there's just pretty basic that you have to have Part A and Part B. You must also join a plan with drug coverage in most cases, and you have to live in the plan's area. So it goes by your zip code. So they're zip code specific, and you can't be incarcerated or unlawfully in the U.S. or live outside of the U.S. Medicare drug coverage, combinations of coverage and cost sharings, benefit structures, and the tiers and the co-payments and the cost of different drugs. And we can give you unbiased information, and then that individual has to make a decision. But we'll go through all of that if you call our office, and we can sometimes set up an appointment and do it virtually. Credible drug coverage. This doesn't come up often, but the coverage that is expected to pay on average or at least as much as Medicare's standard drug coverage. So each year your plan informs you if your coverage is credible or non-credible. And any lapses of 63 days or more in credible coverage, and you have to pay a late penalty, enrollment penalty if you join Medicare prescription drug plan later. So keep that in mind when you're thinking about, you're ready to retire, or do I want to get that, or do I want to continue working? It's a lot of decisions, and you can talk it out. And again, we give unbiased information, and you can make that decision. There are Medicare drug coverage, prescription name brands or generics. And of course, you know that they are approved by the FDA, the U.S. Food and Drug Administration. They're sold in the U.S., not from Canada, and can be used for medically accepted indications. And these prescriptions include the biologicals and supplies associated with this injection of insulin. And it's really important that you make sure when uh, you're doing your drug coverage, that each one of the drugs that you take are on your plan. And these are some of the required coverages for all drugs in the 6 protected area. I don't need to go through all of them, but it's the top ones is the cancer drugs and HIV and antidepressants. So just and all vaccines are pretty much paid for under Medicare Part B insurance, like the flu or COVID-19 or the pneumonia shots. And what are some of the things that I should consider when choosing a plan, Part D prescription plan? Again, does your plan cover all the medications I take? Uh, it's so important that you go over each medication that you take on a regular basis, not just a prescription that you might get if you catch a cold or like a upper respiratory infection with all these allergies are going around in North Texas, but the prescriptions that you take on a daily basis. Does the plan have restrictions, prior authorizations, step therapy, or quantity limits? How much will I pay for the monthly premiums and the annual deductible? And that all important one, how much will I pay at the pharmacy? It's just so much that I can stress that you must make sure and to inform yourself of what those costs would be. And here are some more. We're continuing with what other some of the things I should consider when choosing a Part D prescription plan. Is my pharmacy in the plan's network? It's always important to use a preferred network. When we do the prescription drug on the plan finder, and we'll tell you if CVS is might be your pharmacy, and we might say, stay out of Walgreens because it's not in your network. Don't ever go in there and get anything, uh, except other things that you like from Walgreens, but not your medications. It will cost you more. Can I fill my prescriptions by mail order? Generally, these are convenient because they're delivered to your mailbox. And I know we have enormous heat waves in the summer, and we have the cold weather, and some would prefer not to have their prescriptions in the mailbox. But uh, talk to that plan. They'll send you alerts when it's shipped, and they will send you alert when it's in the mail. What is the plan star ratings? You want to make sure that there's not a lot of complaints, and we'll talk about that also. If I have retiree coverage, will the Medicare drug plan work with this coverage? That's something that you need to know, and we can help you with that. And that Medicare plan finder is absolutely the best thing going when you're looking for a prescription drug plan. I can't stress it enough. Oh, and we'll talk about that next month. Insulin products and the Medicare drug plans. And this was a giant step in helping those individuals in our communities who take insulin, because insulin has been capped at $35. And if you get a 60 or a 90-day supply of insulin, your cost can't be more than $35 for each month's supply of covered insulin. And that is updated in the plan finder, and you can also see that. And this is another
Benefit.
little video.
People with
Oops.
People with Medicare have choices about how they get their coverage. If you have Medicare Part A and Part B, you may have the opportunity to join a Medicare Advantage plan, sometimes called Part C, if one's available in your area. These plans are another way to get your Medicare coverage instead of original Medicare. Private insurance companies offer Medicare Advantage plans like HMOs and PPOs. These companies contract with Medicare to provide you with all of your Part A and Part B benefits. In addition to your monthly Part B premium, you usually have to pay a monthly premium for your Medicare Advantage plan. Some Medicare Advantage plans offer coverage for things that aren't covered by original Medicare, like vision, hearing, dental, and other health and wellness programs. Most include Medicare prescription drug coverage, also known as Part D. There may be other Medicare health plans offered by private insurance companies. You can review and compare all of the Medicare health plan options available in your area by visiting medicare.gov/plan compare. Remember, you can only enroll during certain times and depending on your circumstances. Timing is important to avoid a gap in coverage and possible late enrollment penalties. You can contact 1-800-MEDICARE or a state health insurance assistance program or SHIP office near you for free, unbiased assistance.
Yes, again, we offer unbiased information on helping you with your Medicare coverage. And then the next slide, how should I review my current coverage? Medicare health and drug coverage. Regardless of how you receive your Medicare health and drug coverage, you should consider, again, your health providers that you want to see, access to your preferred pharmacies, access to your benefits and services that you need, the total cost of the insurance premium, deductibles, and cost sharing, and the quality of the customer service you receive. Even if your plan glitters and lights up at night, it's no good to you if you can't use it to see the doctors you want to, or access the pharmacies, and access the benefits that you need, the services that you need, and the cost, the customer service you receive. And will that plan it, the customer service, will they respond to your needs? There's so many to consider, but again, you must choose as wisely as possible, and we're here to help you do that. If you have original Medicare, uh, read your 2024 Medicare and You book and learn about the benefits of the upcoming year. Or you can call 1-800 Medicare, or you can contact our office. You should have received your handbook, but you can it's on the Medicare.gov website if you want to download it and have it. How should I review my current coverage? Again, make a note of these changes, the plan's costs and the benefits and the coverage rules and the plan's formulary and how it will pay and what you're responsible for. The drugs that you're taking now, will they be covered? And what providers and pharmacies are still in the plan's network? You should have that information. We'll go to the next slide. What are some of the things I should consider when choosing a Medicare Advantage plans? Well, there's several. When considering a Medicare Advantage, ask yourself these questions when choosing: what's in your wallet? I know that's a cliche, but uh, we don't know your income and your health status. So it's important to have that frank, open, honest conversation with your doctor about your health and think about what the premiums, deductibles, and co-insurance and co-pays amounts that you'll be responsible for. What is the annual maximum out-of-pocket cost for those plans? What service areas are covered in the plan? Are my doctors and hospitals in that network? Very important. What are the rules I have to follow to access my health care and services and drugs? The plan will send you a notice, and we'll talk about that briefly in upcoming slides. But does it have additional health benefits? Those are some of the questions that you need to ask. And what is the plan star rating? And will this affect any different additional coverage I have, such as retiree benefits? We'll go to the next one. Again, Medicare Advantage plans usually include, they're bundled with a prescription drug plan. Those individuals with Medicare Advantage plans cannot have a Medigap. And if you have original Medicare and a Medigap and are considering switching to a Medicare Advantage plan, please be aware that you will lose your Medigap and you might face limitations on if you decide to go back to original Medicare and you want to pick up a Medigap plan, that it might be somewhat difficult, but you need to understand what your responsibilities are and the Medicare Advantage plan if you change back within the first 12 months of enrolling. What kind of supplemental benefits do Medicare Advantage plans offer? These are set rules by your plan, especially for dental, vision, and hearing. And then the gym memberships, they're important to some people. I had someone call and said they wanted a plan with uh, gym memberships, and we were able to find one in his area. And I gave him the information, I emailed it to him, and he was able to make an informed decision about what his choices were. And not only the dental and vision and hearing, there's optional uh, benefits that you can purchase or mandatory. And you don't have to use the mandatory if you don't want to, but they're in the plan and they're available to you if you want to use them. If you're interested in supplemental benefits, review the evidence of coverage that your plan provides and find out the cost and coverage restrictions associated with those benefits. So this is just kind of telling you a little bit what the Medicare Advantage plans can cover and their special supplemental benefits for the chronically ill. And they're primarily related to beneficiaries who have chronic illnesses. And this is really important if you have that or if you have a family member. These benefits address social determinants like meal delivery, transportation, and home air cleaners. So if you have some of those health issues, that's look at some of those. Not every plan member will have access to the same benefits. Remember, these are zip code specific plans, and you have to choose the one in your plan. And if you want any of these three items in that, so the meal delivery, the transportation, or the home air cleaners, just speak with the plan. And we can help you with that also. Well, other things to consider before joining a plan. Again, we're going over and over about this, the drug coverage. Uh, make sure you have your plan and your plan is credible with the Medicare drug coverage. Do you have other current health insurance? How will it work with your Medicare? And could joining a plan affect your current coverage or your family members' coverage? Medicare coverage for drug costs. Uh, you'll pay your co-insurances and insurance or co-payments. And during the gap, we'll talk about that a little bit, the donut hole, the dreaded donut hole. And you'll pay no more than 25% of the cost for covered prescriptions during drugs once you join your plan and you spend $4,600 based on what the plan drug coverages are. And that's including your deductible. Uh, During catastrophic coverage, you'll pay no more than the 5% once you have your out-of-pocket spending, and it reaches $7,400 in 2024. So take a look at that. We pray that that never happens, but sometimes it does. And whether you have a prescription drug plan or Medicare Advantage plans, there are coverage phases. So keep those in mind. And the star ratings. I have to laugh sometimes that it's almost like a Yelp rating. If you have done reviews on restaurants and hotels, so they star rate Medicare, and the quality ratings that provide a measure of the plan's performance. Uh, Medicare scores Medicare Advantage plans and Part D plans in several categories. And so the ratings range from 1 star to 5 star, with 5 being the highest, of course. Plans are assigned an overall star rating to summarize the plan's performance. The plan also receives separate star ratings in each category reviewed. And the overall star ratings provide a way to compare performance among several plans. So if you like looking at reviews, this is something that's important to you. You should take a look at those star ratings. The star ratings are just only one factor that that you can review when comparing plans. The plans might have a higher star rating, but it might not be right for you. It might work for your sister or your cousin, but you need to take in an account your individual needs on what you require from your plan. It's important to see whether whether the plan covers your health services and the drugs you need and works with the pharmacies you use before considering its star rating. And also keep in mind that the Medicare and You handbook does not necessarily always have the most recent star ratings. So you can go on the website, Medicare.gov website. Extra help and dual eligible special enrollment period. If you have Medicaid and Medicare, please keep in mind that these special enrollment periods, when especially as we assist other individuals with their enrollment, that you can change plans one time per calendar year, per calendar quarter in the first 3 quarters of the year. Use annual open enrollment in the fourth quarter and have another 3-month special enrollment. So that way, those individuals who are Medicare and Medicaid eligible can change and find the best plans that are available to them. Here we go with the 5-star enrollment, special enrollment period. Uh, you can switch to a 5-star Medicare Advantage plan with or without drug coverage during this time. And that is December 8th through November the 30th. And you can only do it once per year. And also keep in mind that that plan will start the first day of the month after you enroll. The star ratings assigned in October and they're effective January 1. And if you may have a coverage gap and pay a penalty if you switch to a drug plan with no drug coverage. And we strongly suggest that you do not do that. And this is, quite frankly, everyone, I don't know anybody that makes that much money, but IRMA is the income related monthly adjustment amounts. It's for people who have higher incomes. And it's just fewer than 7% of beneficiaries are subject to IRMA. And we'll look at that at the next slide. So we'll go to the next slide so you can take a look. Most people pay the standard amount for their Medicare drug coverage. And if your modified adjusted gross income is above a certain amount, you may pay IRMA and IRMA. That total for 2023 Part D premiums are for people with higher incomes, as you can see from the slide. Don't need to go into a lot of detail, but you can see that those individuals do pay more for their Medicare. Okay, and ways to enroll in the Medicare drug coverage Part D is you can go online and go to the Medicare.gov website, visit the plans website if you are online, if you can go online, join online, or contact our offices. You can do it by mail, and you can do it by phone. You can call the plan you want to join. You can call Medicare. Again, Medicare is open 24 hours, 7 days a week, or you can call us. And I've been speaking about this Medicare Plan Finder, and it's the best thing since sliced bread to me. It helps really narrow your search. It's a searchable tool, and it's on the official government Medicare.gov website. And please, 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 when you're searching, there'll be clones that come up, and just make sure it is the official government website, because if you click on it, it'll take you somewhere. You might wind up in South America or Nigeria or someplace. Just be careful that you're using the Medicare.gov site, website, the official website. Uh, we encourage individuals to start an account, and it's available. You can use it. It's You can even turn your computer on in the morning and look, and it'll be the same. It allows you to compare your Medicare health and drug coverage options, Medicare Advantage plans, Medicare drug plans, and Medicare supplemental insurance, Medigap. And the information is just wonderful. And we'll go to that landing page, and I'll show you some of the fantastic things they have done. The homepage. This homepage started displaying this October the 1st. And I have been able to walk people through if they will go to on their, and it's hard to do it on your phone. I'm sorry, it really is. But on a tablet or your laptop, you can just swing through it like a breeze. This homepage will tell you everything you need to do. Any changes that can be found, anything you want, from a starting account to find drug and health plans to find providers, or you can chat or you can call us. And we'll go to the next slide. And I like that guy's suit. So, Medicare.gov homepage. And again, uh, this information loaded up October the 1st, and it provides information on some of the changes for this enrollment period. And also you can find it in your book. And we'll go to the next slide, the Medicare.gov homepage, lower costs for Medicare covered insulin, and all the information. And so we'll go to the next slide. And really you can see, if you have not visited this web page, I encourage you to do that, because you can see at the top, you can find doctors, you can find health plans, and then there's the bars that will take you to your find health and drug plans, find providers, or talk to someone. And I know it's a little difficult to see, but at the very top, there's options to uh, log in or create an account or chat with an agent. But we strongly suggest you start an account. And to the left of that, you will see the menu items. The basic will help you learn more about Medicare options, the health and drug plans, where you can compare prescription drug plans, Medicare Advantage plans with or without the drug coverage, and Medicare supplemental insurance, which is the Medigap. It's very helpful that in finding providers in your area, and you can filter, and you can do 10 miles, 25 miles, 15 miles, however you want to travel, and it will pull up the doctors that are available to you. You could tell I'm excited about that. I love using that. Oh my, and here, and we're Angela's going to talk more about protecting yourself too. She has a wealth of information to share with us. But during open enrollment, it seems that the scammers come out of the woodwork. We have a higher risk than usual for fraudulent activities. So don't let a pushy individual pressure you into to accepting their plan. They cannot tell you they represent Medicare or are calling on behalf of Medicare or visit your home without permission. But you just have to make yourself aware. Medicare has rules about how plans can and cannot communicate with you during open enrollment. Before you enroll in a plan, make sure you understand what the plan covers, how it affects your benefits, and other health benefits such as Medicaid or your retiree or union coverage, and whether the all important the medications that you need to take are available. And this is hard to see, and it's some of the agent brokers' do's and don'ts. Uh, to the time we have included it in the PowerPoint, and you will get this link to the handout. In the future presentations, we'll probably go into detail on what's acceptable and what's not, and what agents and brokers. But again, I'm stressing very strongly, do not let someone pressure you or come to your home and pressure you into purchasing a plan that is not going to work for you. And we'll go to the next slide. Information and help in the open enrollment period. Of course, Medicare.gov. Use that Medicare plan finder. Call us. Call Medicare, the 1-800 number. The customer service assistance for choosing a plan and enrolling. Again, it's available 24 hours a day, 7 days a week. They would not like me harping on that, but I'll say it again. They're available 24 hours, 7 days a week. They're closed on Thanksgiving Day. They have interpreters, and they have over 200 languages. And we're winding up. Thank you so much for your patience and your time during midweek Medicare. We appreciate you. I hope this has been of a benefit to you. And during this open enrollment period, please reach out to us, uh, and that we can assist you in making this most important decision. Any questions?
Thank you, Felicia. There are a few questions in the Q&A. I think we'll hold those until the end so
Okay.
that we can make sure and get through Veronica's presentation. And we can
Yes.
go ahead and start with her presentation. And Veronica, I will turn over the controls to you.
Hi, everyone. My name is Veronica Alegria, and I'm with the Better Business Bureau Education Fund, or Senior Medicare Patrol. So today we're going to talk about everybody's favorite time of the year, Medicare open enrollment. Next slide, please. Medicare is a $1 trillion business, and most of that business is conducted during open enrollment, which is October 15th through December 7th. Next slide, please. During this time, CMS allows Medicare beneficiaries to make changes to their Medicare plans, whether it be a Medicare Advantage plan, standalone plan, or maybe you want to switch to traditional Medicare and enroll into a supplemental plan or a Medigap policy. So unfortunately, during this time, a lot of bad actors and unethical agents come out of the woodworks to try to exploit our Medicare beneficiaries. So you're going to receive a lot of the beneficiaries will start receiving mail from certain healthcare plans, or maybe even phone calls trying to get them to switch their plans. So let's go on to see what to look for in a scammer. So what do you think their aim is? Typically is to steal your identity. That's basically what their goal is during this time of the year, is to steal your identity. And how do they do this? And I'm going to name just a few, and these are the top 5 scams during this time. There's many more, but these are the ones that get reported most often. And one is that they'll offer you new Medicare cards. They'll call the Medicare beneficiary and say, listen, there's a new plastic card or a card with a chip in it that you have to get. Otherwise, you will not be able to access your healthcare benefits in 2024. So, in order for you to receive this card, we will need to verify your Medicare ID number, social security number, in order for us to send out these cards. So what they're doing there is trying to collect enough of your personal information so they could put it to use on their end and start finding fraudulent claims, or even maybe if you provide them with social security numbers, start applying for credit cards, purchasing vehicles that you were never aware of. So please be aware that there is no such thing as a new Medicare card that is going to be issued. Our Medicare cards are still continue to be paper form. And please note that if ever Medicare does decide to switch these cards to plastic, there will be a big public service announcement to let all beneficiaries know that this change is coming, and they'll have certain time frames that you will need to be aware of, that these cards would be delivered to you. And if you don't receive them, you would need to contact Social Security or Medicare and let them know that you never received your card. Another another scam that they would throw on you would be offering you cheaper plans or expanded drug coverage. They'll say, well, you're enrolled in so and so plan, but this plan is offering you more coverage when it comes to your drugs, or maybe you're going to be getting a higher dental allowance. Certain plans only give you $1,500 a year. Our plan's going to give you $10,000 a year. Of course, it may be a lie, but basically, what they're trying to do is gather your information again to convince you that you're enrolling into something that's going to best fit your needs, when in fact, all they're trying to do is collect your information, your private information, Medicare numbers, social security numbers. Keep in mind that Medicare or CMS has these plans. I don't want to say they're cookie cutter, but most all of the plans offer you more or less the same coverage. No other plan is going to offer you thousands of dollars more coverage than the next. So just keep that in mind when you get these phone calls. Another way that they will try to get your information is by offering you refunds or rebates. And what they'll say is, well, Miss Smith, you were at the hospital last month and you had exploratory surgery and you had to pay out of pocket, maybe $1,000 out of pocket. Guess what? We can offer you a refund on that out of pocket cost that you incurred the month before. All we need is your bank information. We need your Medicare number and your social security number to make sure that you're eligible for this refund. And if you are, we can use your bank information to direct deposit that refund. So right there, they already have Medicare number, social security number, and your bank information. There is no such thing as a refund or a rebate on any healthcare services that have been rendered to you that Medicare has already paid for. Just keep that in mind as well. Another way is an offer of free medical supplies or tests. These are very common. We hear about these all the time, especially with COVID tests. This past few months, we had it up in complaints about people receiving COVID tests that they never ordered, but Medicare was billed for in hundreds and hundreds of dollars. They'll say, well, we have this apparatus for your knee, or we have some sort of a test that you can have for free. All we need is your Medicare number so we can send that out to you at no cost to you. When in fact, you know that it is going to cost once you provide them with your information. They're going to take that information and go to the bank. So protect yourself against that. Don't provide them with any information. Just hang up. And the number one tactic that is used during this time of year is the threat of canceling your Medicare benefits. They'll pressure you into believing that you need to switch your plan, or you need to sign up for something, or else you'll lose your Medicare benefits. The only way you will lose your Medicare benefits is if you don't pay your Part B premiums. And some people already have these being taken from their Social Security benefits, but there are some people that do pay out of pocket because they don't qualify for Social Security benefits, but they're paying their Medicare premiums from their own pockets. So this is one of the biggest scare tactics. People hear this and they panic and they act right away and start providing these people with their personal information, which is a big mistake. Medicare loses about $60 billion a year due to fraudulent claims and erroneous claims as well. Understand that not everything is a fraud. I mean, people do make mistakes sometimes in the billing process. Best thing to do is to review your summary notices every quarter when Medicare does provide you with those. Make sure that every claim that has been submitted to Medicare are actual services that you have received during that time period. If there is something there that you do not recognize, maybe the doctor doesn't sound familiar, or maybe the claim is coming from another state that you've never visited, this is something that needs to be reported right away. Next slide, please. So where do you call to remake this report or file a complaint? Is to call the Senior Medicare Patrol. Every state has one. And here in Texas, this is our number, 1-888-341-6187. Please, if anyone experiences any one of these scams or schemes, or someone's trying to collect information from you that you are questioning their, I guess, their intentions, you can call us just to make sure that they're on the up and up, and we can check for you. And if it is something that needs to be reported, we will assist you and in making that complaint. We do work with the FBI, we work with the Office of the Inspector General, we work with the Attorney Generals, and we work with HHSC as well. Next slide, please. So next, we're going to talk about the sketchy. Now, these people are on the up and up. They are people that are licensed to sell insurances. So what is their aim during this time of open enrollment? And you know what it is to switch your plans. These agents believe that everyone needs to switch. Yes, it's okay to switch. Some people might need to make changes because maybe their plans are moving out of the area, or maybe some of their prescriptions are not going to be covered the following year. And yes, there's some change, some switching that might have to be done. There's about 70 million people enrolled into Medicare, and maybe 15 to 20% of these people will need to make changes during open enrollment period. So the approach that these people use to get you to switch are misleading ads and marketing tactics. How many of you remember last year's commercial with Joe Namath and how he was, I guess, misleading the public, saying that you could get $100 more added to your Social Security checks if you call the 1-800 number. So many people will call the 1-800 number and find out that they weren't qualified. And we know, as benefits counselors, we know what he was talking about was the Medicare savings programs. And in order to qualify for state assistance, you have to meet certain guidelines. So many people didn't meet those guidelines. They would call the 1-800 number and they would tell them, I'm sorry, you don't qualify, but since you're on the line, let me tell you about our plans, and then continue to push them to switch from their current plans. Or you'll have an agent use high pressure tactics. And you have to understand, if you feel pressured by someone, chances are that this individual is not working towards your best benefits. They're working toward theirs. So just keep this in mind. If you feel pressured, chances are it's not at your best interest to listen to this individual and even uh, agree to switch your plan to whatever it is that they're suggesting. Or they'll tell you, hey, you need to act now. This offer will be off the table tomorrow. So if you don't make up your mind by 5 o'clock this afternoon, we will not be able to offer this tomorrow. This in itself is also a lie. Keep in mind, there's 7 weeks in the open enrollment period that beneficiaries have to make these decisions. Nothing is gonna expire in 24 hours. There is no special discounts that Medicare is offering or any of these plans are offering that are time limited. So October 7th through October 15th through December 7th, that is your time to make these decisions. Now, if you're going to wait till the last minute, which I suggest you don't, because when I was a benefits counselor, we had people wait until December the 6th or the 7th to make up their minds, and they're feeling pressure to pick a plan. So, if you're in the market to switch, please take your time in reviewing your options so you can make an informed decision and not make one quickly because you're running out of time. Next would be they'll be claiming to be from Medicare. So they'll call you on the phone and say, "Hey, this is Joe from Medicare, and I'm calling you because it's time to switch your plan." The reason they're doing this is because they want to give themselves more credit. Like, say, we're credible. Listen to me. I'm calling from Medicare and I'm acting on your best interest. So do what I say type of thing to try to convince you that they're on the up and up. But just keep in mind, Medicare will never call you unless you initiate that call yourself. If you have a question about Medicare, you have certain issues going on with a certain claim, and you call Medicare and they give you the option to get a call back, then yes, Medicare will call and return you that call, but they will never initiate a call to you during this time of year or any time for that matter. Or they'll call without permission. A lot of beneficiaries do not know about the, I think there is an SOA where it's I forgot I'm brain fart, but yes, there is a certain form. It's a scope of appointment. It came back to me. It's a scope of appointment that needs to be filled out before an agent is allowed to contact you. So if you get a phone call from an agent that's trying to sell you a plan, all you have to do is ask, did I fill out a scope of appointment with you? Because I know I need to fill this out at least 48 hours before you can contact me. I did not give you permission to contact me. I did not give you permission to come knock on my door. So the minute you mention the scope of appointment for to these individuals, they're going to hang up on you. They also don't disregard the do not call list. So a lot of beneficiaries have put their names on the do not call list. They don't care because they're sketchy. They're out there to do you wrong. So they're not going to honor the do not call list. Next slide, please. During this time, we do have, don't get me wrong, we do have people that are sound. These are the agents that are out there, and their specific aim is to serve. Um, to be in this kind of business, the Medicare enrollment business, as an agent, as a benefits counselor, you have to have heart. You have to have patience. And what this means is that you're going to take the time to sit down with a Medicare beneficiary to evaluate their present plan. You're going to ask them, are you happy with this plan? Are you happy with the doctors that are in the network? Is this plan currently covering all your prescriptions? If there's for any reason there is a change in the coverage, this is a time that this individual would take to explore other options. Maybe they want to switch. Maybe they're on a Medicare Advantage plan. Maybe they want to go back to traditional Medicare and purchase a supplement, which means they would have to purchase a Part D plan. See, all this comes into play. It has to be time that the agent has to take to sit down with a Medicare beneficiary. And on average, it takes about an hour, depending on the number of prescriptions the individual has, because a good agent will take the list of medications and make sure that those medications are on that particular plan's formulary. Otherwise, it's going to be of no good to that beneficiary if even just one medication is left out. That means that they're going to have to pay out of pocket at 100% for that medication. Another thing is that a lot of these sketchy agents won't take the time to make sure that their doctors are in network. Some beneficiaries have three, four, five doctors, and it's very difficult to make sure that all the doctors are in the same network. A lot of these sketchy agents will not take the time to make sure that their doctors are in network. So this would pose a problem come January 2024 when the individual tries to go see their specialist, and voila, we're not in network. We can't see you, you know? So there they go, trying to have to switch back to something else. And with Medicare Advantage, they have until the end of March to make those changes as well. Now, during this, an, uh, a sound person, someone with a sound mind, someone who is working towards their best interest, will enroll only if necessary. This means if they find that your plan is going to work for you come 2024, there is no reason for you to switch. You're fine just to continue with that coverage. They will let you know. Now, that means that there won't be commission that they will receive because they didn't enroll you. But this is what determines if someone is ethical. They're not going to care that they didn't receive a commission. They may have spent an hour with you, excuse me. They may have spent an hour with you reviewing your plan, and at the end of the day, they weren't able to switch it because it wasn't necessary. You know, benefits counselors do not gain a commission. Everything is done free of charge. They don't represent any companies, so they're considered unbiased. So they'll give you your options and you get to choose and make an informed decision. That's what is important during this time of year, is that the beneficiary gathers all the information, is aware of all their options, and they are able to make an informed decision, not a pressured one. And next slide, please. So what can you do during this time? How can you get help in making those decisions? You can either contact 1-800-Medicare at the number provided above at 1-800-633-4227. Just keep in mind, this is a very busy time of the year for Medicare. So you will be on hold for hours trying to get enrolled. And they will have to read you all the little acknowledgments and whatever. So it takes longer. Excuse me. Or you can contact the Area Agency on Aging, where they have these beautiful people called benefits counselors. They provide unbiased comparisons. They will take the time to sit with you, go over your options, review your current plan, and make sure that the plans that are offered to you are the ones that are going to best meet your needs in 2024. You can also go into the Medicare.gov website. It's very easy to use. And if you're pretty well, if you're computer savvy and you know your way around a computer, you won't have any problems navigating through the Medicare.gov website. All you have to do is create a user, an account, and you're able to go in there and check your current coverage, check your prescriptions, and make comparisons with standalone plans versus a Medicare Advantage plan. It's very useful website, and I encourage those that are able to navigate through the system to go ahead and use Medicare.gov. It is tremendous help, and there's even an app, a Medicare app that you can download onto your smartphones if ever you have questions about certain Medicare coverages. You would find it in that app. You can find it in the App Store. It's just called Medicare. Or you can find yourself a legitimate broker, someone that you trust. Maybe family members have worked with this individual and they act on their best interest and not their own. I was in a webinar with CMS recently, and I was shocked when I learned that CMS is encouraging some of these brokers or insurance agents to assist beneficiaries with their public benefits. I know there was a rollout. A lot of people got disenrolled from the Medicare savings programs. So CMS is giving them the go ahead to help enroll people with into the Medicare savings programs. I've known some in this area that are doing just that. They bring the people in and they help with their applications to get recertified for the Medicare savings programs. And my only problem with that, and I don't know if I let CMS understand where I'm coming from, and I'm sure Felicia and Melinda know, is that when people come in for help with their Medicare savings program applications, once they become eligible, the broker or the agent can switch them to whatever plans they want. You know what I mean? So to me, I brought this up with CMS, and CMS was like, no, no, they're fine. That we encourage them. A lot of people need help. There's not enough out there to offer the assistance in completing these forms. But just keep in mind, if anyone you know is out there asking for help with their Medicare savings programs applications, again, the AAA Area Agency on Aging has these benefits counselors, wonderful, that are very familiar with these type of applications and that will help in renewing their benefits as well. But like I said, there are some legitimate brokers out there and agents that will go above and beyond to help the Medicare beneficiary get the services they need to make sure they're enrolled in the correct plans for the coming year. But like I mentioned before, if ever there is someone that experiences any of these scams or schemes, or they feel that they were pressured into enrolling into a plan that they really didn't want to enroll in, but they did anyway, they can call Senior Medicare Patrol at the number I provided before at 1-888-341-6187, and we can help you file a complaint and try to put a stop to people taking advantage or exploiting our beneficiaries. So that's all I got. Thank you.
Great. Melinda, do you want to go over the questions?
Yes, Felicia and I both were actually answering some of the questions. So
Nice.
there were some that was a little difficult to answer in writing. So one of the questions, first of all, thank you, Veronica, for providing all that information. That was great. And some of it was updated. So that allowed me to know the extra stuff that was going on. So thank you.
You're welcome.
What is different about the Medicare plans for someone in a long-term care facility? If someone has Medicare and they're in a long-term care facility, Medicare pays the same. They will pay 20 days at 100%, and then they will pay up to 100 days, 21 through 100, with a copay. So an individual will be responsible for a copay. After 20 days, Medicare no longer covers the skilled nursing because now it becomes long-term versus medical. So if someone is going to be in a nursing facility for long-term, they may have a long-term care insurance. They may have savings to help them. They may have a supplement that may pay the copay between days 21 and 100, or a retirement policy. But after that 100 days, if someone doesn't have the means to pay, then they can apply for Medicaid after being in the facility for 30 days. So they do have to be in the facility for 30 days first, and then they can apply for Medicaid. And if someone has additional resources where they would not qualify, because the limit is 2,000 for an individual or 3,000 for a couple. So if someone has more than that in their savings or in investments, then they would have to cover their stay for that period of time. So you can contact a local SHIP to find out more information about that. Felicia, did you have any that you wanted to comment on? I know you were answering some.
Yes, I had started the one. I have some clients who get some money on a debit card from their insurance that
Mhm.
they can use for groceries and such. And how can I direct other clients to get such benefits from their insurance company? I suggest they call the plan to see if they have that benefits for groceries. Not all of them will have that, but they can call their plan and ask that question.
Yeah, and unfortunately, from what I've seen, the plan finder doesn't provide that information. So it's impossible for us to know if they provide that. The other way to possibly find out is maybe on their website. They may have additional details about plans on their website. So maybe trying that to see if that particular plan has those additional benefits. And I know Felicia talked about the benefits for the chronically ill. Those are additional benefits that are not primarily health related. And as she mentioned, some of them are optional, but then some of them are mandatory, and that's part of the plan. So keeping that in mind. So if you're in a plan and you need those additional benefits, you may have to look at another plan, but then you have to consider your prescriptions, your providers, and all of that. So keep that in mind. Someone asked about changing. Can I change a Medigap policy company and still keep my Plan F? If someone's already on Plan F, they're able to keep it. However, if you change policies, the cost of that plan may be a lot more than what you're paying now if you qualify to get a new policy. Because once you're on Medicare for 6 months, then your application goes through underwriting if you do try to change. So they could charge you higher premiums, or they could deny you coverage. Somebody asked, what is CMS? CMS is actually the federal agency called Center for Medicare and Medicaid Services. So Center for Medicare and Medicaid Services. We most of the time call it Medicare, but that's the official name. What is a Medicare savings program? Medicare savings programs are programs that help individuals pay their Medicare premium. There are actually 4 different programs. We deal with 3 of them. And if somebody qualifies for the highest level, they also get help with their deductible and their copays. So 3 different levels. The highest level does help with deductibles and copays, as well as the Medicare premium. The other 2 that we deal with only will pay the Medicare premium. So the highest cost, the highest income for an individual is a little less than $1,700 a month gross income. So they have to add back in their Medicare premium to see if they would be eligible. But we are happy to help anyone apply for that program. We can do that through our office, or you can go to yourtexasbenefits.com. to
Um,
apply.
Melinda, on that question, you had said you'd given us a threshold. Is that threshold just for a minimum to get any kind of Medicare savings program? And if to qualify for the highest one that you said does their copays and the premium and I'm sorry, deductibles and copays, do you know what the threshold is for that?
The threshold for getting the deductibles and premiums, the deductibles and copays, as well as the premium, that's about a little over $1,200 a month gross income.
Great.
Mm-hmm. So yeah, we can definitely break that down. But if someone has questions about, okay, do I qualify? We give them the highest, and then we start then looking at the specifics. Do long-term care facilities accept Medicare Advantage plans? That's a good question. Yes, they do. However, some of them are not in network. So therefore, it's important if people are signing up for an Advantage plan that they check with the facility that's near them to see if they do accept that Advantage plan. We have heard in the past that individuals have been told or asked to switch back to original Medicare. There could be several reasons for that, but it's not that that particular facility doesn't accept the Advantage plan. So that's another story. Felicia, did you have any others that you were looking at?
Let's see. Patty Cochran. I had messaged her to check with the plan, but Melinda, she says she needs a whole list of all the providers who are contracted with that plan. She's having trouble with discrimination by providers who are religiously affiliated.
Okay, if someone is looking for providers in a particular plan, then I would suggest contacting the plan to get a list of those providers.
Oh, and I have
Can
to,
we go ahead and go ahead.
I'm sorry, I have to apologize to Veronica for mispronouncing her name. I'm so sorry.
All right. Can we go to the CEU slide, and I'll go over the CEU stuff while you guys are looking through to see if there's anything else. Is that all right?
Okay, one more before you actually go over that slide. Somebody asked about applying for Medicaid. If someone wants to apply for long-term care Medicaid, usually they have to be on the list for Health and Human Services before they can actually apply. But they can, we can assist them with that application. With the discontinuance of the pandemic, there is a initiative going on to help people reapply for some of those benefits also. So feel free to have them contact our office if they're within our service area, or the numbers for Texas SHIP or the national SHIP. I have put in the Q&A, and I'll also put in the chat as Marty goes over the CEU questions or CEU information.
Okay.
Thank you.
Great. For those of you joining us for CEUs today, we are set up to provide complimentary CEUs for licensed social workers and licensed professional counselors that are licensed in the state of Texas. If you have a different license in Texas, or you have a license outside of Texas, you're more than welcome to go through the process, get a certificate. But please note that we have no leverage in getting them to accept that. It's totally up to them, but we're set up with these two. If you have any problems there, feel free to call me. The certificates of attendance is also available to anyone who would like one. The guidelines are the same. Today's webinar is worth 1.5 hours CEU credit. you must have completed the entire live webinar in order to qualify for CEUs or a certificate of attendance. And you must also complete the Google survey evaluation form. It should give you the chance to go to that as you close out of Zoom today. I think it says, would you take a survey for us or something of that sort? And you would either need to do that, or the link for that will also be in the follow-up email that I send out. They will also have the attachments of the slides in the follow-up email as well. And I'll include the phone numbers that Melinda just spoke about. The survey link will be up for until 5 o'clock on the 3rd of November. And then if you could give us about a month after that to get the certificates out to you, we would appreciate that. And if you don't get them by then, please feel free to reach out. Could we advance to the next slide?
Mm-hmm.
Coming up very soon, we have this will take place on our regular midweek Medicare day from now going forward. We'll be on the second Thursday of each month, and so on the 9th of November, they're going to go over the Medicare Plan Finder and talk about scams, phone scams, when quote Medicare calls you. And so we hope you all, a link to sign up for that or for the flyer for that will be in the follow-up email as well. Anything else that I can, that you guys have?
There were a few more questions. Let me get to, okay. Somebody asked what the function was for CMS. And CMS or Medicare actually provides health coverage to more than, I don't know, I think they're up to 100 million people with Medicare, Medicaid, the Children's Health Insurance Program, and the Health Insurance Marketplace. So they cover all of that, providing that health coverage, and then, of course, contracting out to agencies to help with that. Somebody asked what kind of benefits are offered for memory care facilities. Not much. There may be some facilities that will accept Medicaid, but that is few and far between. So if you can be more specific, then we can help answer that question. What do I do when the plan tells me that I have to find the provider first and then call them? There are no doctors in my area that I know of who would affirm and support a gay senior, let alone provide transition hormones. Unfortunately, we don't have the detailed information. Each plan does have a directory of their providers, so they should be able to assist with providing that information. But feel free to call if you are in our service area so that we can maybe assist you further in detail with your particular situation.
Yes, and I'm sending them my phone number right now.
Okay, great. Wonderful. Okay, when applying for the initial Medicare, are the Medicare plan done there? Okay, I think what Jose is asking, and correct me if I'm wrong, when someone applies for Medicare, can they also apply for a Medicare Advantage plan? The federal government insurance is Part A and Part B, hospitalization and medical insurance. But if someone wants a Medicare Advantage plan, then they can view those plans on Medicare.gov and sign up there, or call a plan directly if they already know what type of plan they want to enroll in, or which plan they want to enroll in. So the federal government doesn't assist with enrolling in a Medicare Advantage plan. You can do that online at medicare.gov. Or if you know which plan that you want to enroll in, you can contact that plan directly. I believe that's all the questions I see.
Well, that is a wealth of information.
One more. Can someone have senior Medicaid and also apply for MSP, or are they the same thing? No, they are different. There are several different Medicaid programs. There's a Medicaid program to help pay medical costs. There's a Medicaid program to help for long-term care. So those are two different things. Sometimes it could use the same application, just depending on a person's situation. But the Medicare Savings Program has an easy application where someone can apply for that program. But Medicaid is a little more complicated, and they may have to, like I said, be on the list before they can actually apply for Medicaid, long-term care Medicaid. All
And I
right,
apologize.
Carrie, move it
I
over.
I apologize to the person. I have fixed the problem with the Eventbrite. I don't know why I had the problem. It did it yesterday on another training, and it did today on our next month's training, where it says it's no longer taking registrations. I fixed that. You should not have a problem going in. I don't know what the problem happened, so it could happen again, I guess. But please email me if you have any other problems. So, Melinda, Veronica, and Felicia, thank you so much. It was very, very informative. And I want to point out that that not only did you learn all about Medicare today and all of this, you also learned what kind of suit to wear if you want to woo Felicia at any time. So thank you all so very much. Always full of good information. And so thank you all for joining us. And we
Thank you, Marty.
we should
Thank
all hope
you.
have a wonderful day.
Bye, guys.
Yes.
Thank you guys. Thanks.
All right.
Take
Have a good
care.
one.
Be safe. Bye-bye.
Bye-bye.